Well, you know, nothing beats a polished, glowing complexion, according to Calgary facial cosmetic surgeon Dr. Kristina Zakhary. There are many non-surgical ways to achieving it. Luckily for those who don't like knives. So welcome. Thank you for coming in
Thanks
today.
Thanks for having me.
Now, it's looking very winter-like this week, and we know winter can be hard on the skin. What should we know?
Well, the condition of the skin changes from summer to fall and winter, and the way it changes is it doesn't become all of a sudden dry from oily, but it loses moisture, so it becomes dehydrated, and we get a buildup of dead, dry skin cells. So the skin looks uneven, parched, and dry, and most people complain about that. So there are options on how to improve it.
Okay, so I want to know what those are. You have some products here, but also, obviously, people can come in and talk to you at your office about stuff like that.
Yes, definitely. It's always good to see a professional who's trained and skilled in skincare, like a dermatologist or a facial cosmetic surgeon, because they'll be able to properly diagnose and manage your skin. But for the fall and winter time, the most important things to consider are, well, there are three.
Okay.
The first is to wash your face with a cleanser that doesn't strip your skin of its own oils that are important to keep the moisture and the water in the skin.
Okay.
The second is to moisturize with an appropriate moisturizer for your skin type. So for example, if you have oily skin, then you want to moisturize with a moisturizer that has water base as opposed to an oil base. And if you have normal to dry skin, then you're probably looking for a moisturizer that's oily based, and you're looking for plant-based oils like shea butter or cocoa butter,
right,
as opposed to mineral oils, because those might clog your pores.
Now, we know that in the summer we're very conscious about SPF and UV rays. Do we need to be careful in the winter as well, or can we kind of drop that SPF from our moisturizer?
You definitely need to be careful in the fall and the winter time, because you can't judge the strength of the sun by the temperature outside.
Right.
And in fact, the sun's rays can bounce and reflect off of sidewalks, snow. They'll penetrate through windows, and they'll even penetrate through clouds. Like on a cloudy day like today, 80% of the sun's rays will penetrate through the clouds. So it's important to put sunscreen, and you want to use an SPF, or sun protection factor, of 30 or more. 30,
because most of them, okay, so we're seeing a product here that has SPF 30.
Yes.
Most of the products that I'm seeing at the drugstore, for instance, have SPF 15 or so that doesn't cut it.
That doesn't cut it. 30 will give you a 97% protection. Anything higher will give you a 98 to 99% protection, so it's not that much more. So 30 is enough, and about half a tablespoon is enough for your face and neck.
Right.
And then a shot glass is enough for your entire body, an average size body. So, and it's important to put it on just like in the summertime, about a half an hour before you leave the house, because that will protect you against the harmful effects of the sun, like skin damage, losing moisture through the skin, and then of course skin cancer.
Now, this is something I've always wanted to know from an expert. You go to a drugstore, all of the products say anti-aging, will correct your wrinkles, blah, 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 you don't need Botox. Is that all just hooey?
No, they'll both home products and office products will get you from point A to point B, but the office products and devices are far superior. They'll get you there faster and more effectively, because usually they have medical grade ingredients in them, and they have to have clinical research to back up their claims.
Right.
Whereas at-home products usually are less intense because of safety reasons. But when in doubt, talk to an expert. They'll be able to guide you.
And so what do most people come to talk to you about? What are people's common concerns?
Well, first, people come with a common concern of looking tired, and then when they get more specific...
Sleep can help with that,
yeah,
maybe.
definitely. But when they get more specific, they're concerned about the dry skin, the rough skin, the fine lines and wrinkles, acne scars, discolorations. And so there are luckily there are many options to treat those issues.
It's amazing how far this has come, you know, in terms of the procedures that you offer and the non-scalpel related procedures.
Yes, for those of you who are scared of the scalpel, it doesn't have to include a scalpel. For example, I use a medical skincare line to treat skin most of the time, and I usually couple that with laser treatment to refresh the skin, take away the old skin and bring new fresh skin, so you just look more polished and clean. And it all is non-surgical.
Oh, we actually have a before and after, so this is laser surgery?
So this is a combination of this medical skincare line that has medicines in it that take away discolorations. Also, they make the skin more even. And then there's a laser treatment that's done shortly thereafter to improve the texture of the skin, so you can see that the wrinkles on the one side are less prominent than the other side. And so this is all, of course, non-surgical.
That's good to know. Well, thank you, Dr. Zakhary. I'm going to go head to the mirror and take a closer look. Thank you for coming in.
Thanks for having me.